Hi, Mr. Perky. How can I help you?
I don't know. I think I have depression.
Can you explain, Mr. Perky, why you think you have depression?
I don't know. You should explain. You're the doctor.
This is a very common scenario in my OPD. Anything and everything related to mind is termed depression. In fact, whenever we ask about the history of any psychological ailment in patient or family, most common word used is depression. For us who are trained to use psychiatric terms with discretion, it becomes necessary to get to understand the symptoms before a diagnosis is made, because mental disorders have been categorized based upon symptom clusters. We have a number of categories and over 100 codes for diagnosis in International Classification of Diseases. For general purposes, though, the spectrum approach is preferred, which means that disturbance in mental functions don't happen in discrete regions of the brain. One thing affects the other, and so same symptoms can occur across several categories of diagnosis. So, common mental disorders are identified because they are common and because they are disturbances of the mental function. Most common mental disorders belong to the depression spectrum and anxiety spectrum. For those with academic interest, WHO has listed 5 main categories, namely depressive disorders, bipolar disorders, schizophrenia and other psychosis, dementia and developmental disorders including autism. Although I wonder why anxiety is not in the list. ICMR identified depression, anxiety, schizophrenia, bipolar disorders, idiopathic developmental intellectual disabilities, conduct disorders, and autism as common mental disorders in India in its first comprehensive study done on disease burden due to common mental disorders in India in 2017. In my clinical practice over last 18 years, the most common disorders seen in psychiatry OPD are anxiety disorders including OCD, mood disorders including depression and bipolar mood disorders, somatoform disorders or psychosomatic illnesses, substance abuse disorders including alcohol dependence and cannabis abuse, which are most prevalent in our context, and personality disorders, especially borderline personality disorders and anxious avoidant personality disorders. The not so common mental disorders exclusive to psychiatry OPD are psychotic disorders including schizophrenia and persistent delusional disorders, intellectual subnormality, eating disorders, pervasive developmental disorders like autism. Now, before we try to understand these terms, mental disorders are disturbances in the normal brain functions like mood, feeling, emotions, thoughts and perceptions, and one function affects the other. So while for clinical purposes and insurance purposes we may define a category, but for treatment purposes there is a dimensional approach. In other words, we start for treatment of symptoms. So when someone says that marital conflict made her psychotic, treating conflict at this stage, does it treat the psychosis? It's only when psychosis has subsided that we can identify triggers and deal with them. In this era of information overload, search engines are the major source of information. And as I have always maintained, information is not same as knowledge. So people Google their symptoms and come up with a diagnosis and even come to a doctor asking for a particular treatment. I'll give you an example. Recently, a teenager came asking if I did DBT because he had BPD. Saved me a lot of time but wasted his opportunity to get properly treated. Similarly, parents get completely hassled by their internet savvy children telling them that they can't study because they have ADHD. Many even think it's an excuse. But a better approach would be to allow the clinician to diagnose the problem instead of feeding it to them. Let them do the hard work. Now, let's look at some of the myths associated with mental disorders. The common one is anxiety and depression are not diseases. Doctors make them up. Have you heard people say it or said it yourself? It's normal to get upset. Why call it a disease? Or it's my nature since childhood. I used to always get anxious. My clients have even told me stuff like, my doctor told me don't go to a psychiatrist. They will just give you one or the other diagnosis. Or even the friendly neighborhood chemist gives advice like, why do you need these medicines? You look perfectly normal to me. As if horns must appear when one gets depressed. Truth is that mental health disorders have always existed. Initially, when we didn't know much about the brain chemistry, we blamed it on the demons or lack of willpower. Today, research has shown critical neurochemicals that are responsible for many of these psychiatric conditions. And we have seen moods change, thoughts get better, anger subside, and lives improve with medicines used to treat these conditions. There is immense amount of research in this area, and it didn't start because pharma companies wanted to make a fool out of people. It has been the effort of common human beings who dedicated their lives to understand the science of mood and mind. And had they not done it, we will still have demons and willpower to blame, but no specific solution for our issues. And imagine if there was no pharmaceutical research. We will have no drugs to prescribe at all. What will I give you for pain then? Reassurance? Another common one is doctors who treat mental health disorders give sedative drugs that cause addiction. Let me tell you a story. Once upon a time, a group of smart people set out to define medical specialties because one healer could not treat all and more precise treatment required more focus. So while all specialties were being defined depending upon various organ systems, like the food digestion goes to the field of gastroenterology and eye goes to the field of ophthalmologist, etc., one area remained a mystery. Who takes the crankiness, the mood swings, the sadness, the ghosts and the fairies? They could not localize the mind. So they said, let's experiment, and made a mental health specialist. His job was to deal with all that no one could understand and to put them all to sleep. Is that what you think? No, that's not a true story. And yes, I made it. But somehow many believe it. Otherwise, why would you think that we spent 10 years in medical college to learn about how to make addicts out of normal healthy community? Sarcasm aside, a psychiatrist trains like any other doctor, and it's unfortunate that at times even doctors from other specialties fail to understand that when they ask us, don't give sedatives, huh? Or even better, calm him down because he's making a life difficult, but don't sedate. I hope I had a magic wand or some mind possessing superpower, but then that's our next myth. So they say mental doctors, pun intended, can hypnotize, stigmatize, narcotize. I told you I'm also a poet. But coming back to psychiatry, psychiatrists are scientifically trained modern medicine doctors who follow international guidelines for diagnosis and treatment. Hypnosis is a separate area of research, and anyone may choose to learn the art or science. But it's not voodoo or magic that we can do unless we specifically choose to learn it. Also, just meeting a psychiatrist doesn't make one sick. The process requires a lot of understanding and empathy before a diagnosis is confirmed. Sometimes diagnosis can change as understanding improves, and therefore initial focus is on symptom reduction. And the next one is psychiatrists are themselves psychos. Well, I won't contest that. Let's keep some aura alive. We will try to tackle specific doubts regarding specific conditions as we deal with them in future episodes. In case anyone requires any clarifications, please comment in the chat box and I would try to address them according to my abilities. In the meantime, take care of your mind. This is Dr. Jyoti Kapoor signing off till the next time. Please remember to subscribe, like and share, and search for our YouTube channel Manasthali, where mind meets matter.